In our meeting, and we pledge allegiance to the flag. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I see no public, so we'll dispense with the comment. Election of officers. Oh, good. I don't need to be chairman anymore. Somebody else
Do
needs.
you want to be?
Not necessarily, no.
What if we wanted you to be?
So I think it needs to start down in that direction somewhere.
Down in this, well, since we're all three. If Chuck is not interested in it again, I would nominate Don Lettico to be the chairman. It's your turn,
It is, Don.
Don. It is your turn.
Yes.
If elected, will you serve?
I'm not Lyndon Baines Johnson.
I would second that nomination.
I would vote aye.
Oh.
Aye.
Aye.
Okay.
Okay, Donald, you're elected as chairman, and we need some other officers like a secretary, treasurer. Is it combined or separate?
No, it's separate.
Okay, let's go for a secretary.
I would nominate Charles as secretary because he looks like he's got fine handwriting.
I'm not sitting in your lap. It's clear right now.
This is being
But I would
recorded.
serve.
We'll second.
Where's all the decorum?
Okay, Gerald is moved and seconded. Those in favor?
Aye.
Gerald's the secretary. And for treasurer, it's either Judy or Jane. What's it
Well,
gonna be?
let's now, I'll nominate Jane to be treasurer this next year.
Is that okay, Jane?
I can't hear anything.
Oh.
Just say yes.
We were talking about nominating you for treasurer.
Oh, okay, sure.
Okay, sure. I'll second. Okay, it's moved and seconded. Those in favor?
Aye.
Aye. Thank you. Okay, is that enough, officers, for you?
It is.
All right.
Thank you.
Yep. Very good. Okay, Don, I'm going to turn this over to you.
We have the approval of the consent agenda. Has everyone had a chance to look over the minutes and everything that's on the agenda?
Yes. I move that we accept the consent agenda as stated.
I'll second that.
Okay, been moved and seconded to approve the consent agenda as presented. All those in favor?
Aye.
May I make a recommendation that you sit next to the phone because Jane probably can't hear you?
Okay, that's good suggestion.
Because I don't think she heard.
Jen, did you get the check signing list?
I did. He just gave it to me.
Somehow, some way, I didn't get that. I got it, I think everything, I got everything else, I think, but I didn't get a check signing thing.
I'll have to find out why. But at least you got everything else.
I did,
It's a step forward.
I do think I did, Jen.
We have you on the 23rd.
Yes.
Okay.
Okay, Jane, did you hear that the consent agenda was approved as presented?
I kind of heard that, yeah.
Okay.
And Jane, I've got you on check signing on the 9th. Is that okay? Of August?
I sent an email around. Is that the day I signed up?
Yes.
Yeah.
Okay, thank you.
Okay. Next on the agenda, the May 2017 financial report. Cheryl.
Oh, I don't know. I can't make it go. Thank you. With that.
I'll talk
Obviously,
loud.
the mouse doesn't want to work.
Okay. What, this?
Spacebar.
Okay. All right, so May was a pretty good month. Patient-wise in the hospital, we had 347 patients. Our average for this year is 377 patients, so our May patients was a little bit slow. The high points were surgical, and even though those numbers of patients weren't huge, some of the cases were bigger cases, so that contributed to revenue. The other thing that was big this month was our ancillary services. Lab, for instance, our monthly average is 2,403 encounters, but in May we had 2,615. Radiology, our monthly average is 534, but in May we had 655. So very busy, driven by good hospital counts and certainly the surgical patients. Health clinic was also very busy, and I'm sure was driving the ancillary services. This is our monthly gross charges. This is the first month ever that we've broken $3 million. Our gross charges for the month were $3,022,000. That was awesome. Our monthly average is 2.6 million, so a good month. The collections on AR, this is May that we're looking at right here. We had a good month, excuse me, in May with close to just around $2 million. June it dropped back down to 1.5 million. This is good news right here. This is our days in AR at 69, so it's the lowest it's been in the last 3 years. So that's awesome, and all that cash that came in contributed to that. Our days cash on hand for May was 111. Kind of feels a little close to the line. The good news is that we received a check for $225,000 from Medicare in June, so that will be effective in June, but that will really boost our cash and go straight to our bottom line. And also, this does not include $700,000 that we have paid for construction spending that we haven't borrowed on. We're going to hold off borrowing until it's all done so that we don't have to, because it'll cost us several $1,000s, and so I feel like it's better to kind of ride that out, and we'll end up borrowing just between $700,000 and $1 million. So
I did notice that the sales in May were 3 million, but the collections were down, and days in AR are down.
yeah,
So how do you,
the collections were actually up. I mean, the collections in May were like $2 million. That was a huge month.
That's really from 2 months before.
Well,
That's correct.
and the collections in May really had more to do with catching up in the clinic than they did with the hospital, honestly. So,
oh, okay.
yeah.
One other thing that I might add, keep in mind, we have submitted our application some time ago to have our clinic in Alturas become a part of the district. And that should go into effect as of February 1st. It hasn't happened yet, but when that does, there will be a resulting increase in our cash because of our charges.
Rebuild.
Rebuild all of that.
So are we going to be able to restate our stuff retroactively to February and integrate that change, or is that too much to
I
ask?
think it will depend on when that, so we have to wait. CMS has approved it, both on the buying and selling side. So now we're waiting for the state of California. The state of California is 6 months behind, but our auditors are going to, are trying to pull some strings if they can. I mean, it's not easy, to see if we can get bumped up. And then I can't imagine why they wouldn't backdate it till the actual February 1 date, but I would hate to accrue revenue before I knew that for sure. And also, I'm thinking the year is going to close before.
Right, I was just thinking.
And then I don't think we're gonna, it'll benefit next year.
A lump sum entry next year.
Yes.
They may want to go back.
Right.
Well, we could go back, but I don't know if we're gonna be able to book it into this year. I think it's gonna get booked in next year, because last year will be closed and zipped up and locked up and you can't.
Well, if it's material, they'll go back and
They could.
restate last year.
It would be material.
So will you actually have to rebill it?
Yes.
Using the correct or the changed tax ID.
And the new rate, the higher rate.
And keep in mind, that's what we did when we converted Lake County Medical Clinic. And we had applied for it to be a real health clinic. That application date, even though we filed it, was effective November 1st. We didn't get our approval until February. And we had to go back and rebill all those claims at the different rate.
Right, that was in 1 year. This time we got our fiscal year end in between.
Yeah.
Will you have to rebuild this time around, you don't think?
You'd have to, you would have to rebill all the, not every single thing, but all the ones that would get paid by Medicare or Medicaid at the higher rate. And then they'll just pay the difference. Or they may tell us we have to give back all the money and we'll probably cross that bridge when we come to it and see how big it is and what date it is. And then kind of work with our auditors to figure out what we can be allowed to do to be the best thing for us. But it should be good for the bottom line. Okay, so if you added back the 225 and the 700 we could borrow, our days in AR would be at 125, which is a little more comfortable than 111. Okay, so our profit and loss for the month of May and for year-to-date, our net revenue for the month was $2.3 million after you get all of our contractuals. So our revenue is $340,000 above budget. Our expenses are $280,000 over budget. When I look at the detail, I can tell you the major numbers in that are $90K that went for wellness, $47,000 on orthopedic department, $60,000 that was paid for temp labor over budget. Our bad debt for the month was $38,000 higher than budget for the month, but for the year it's right in line. So it's just a factor of it going up and down. But for the month it was high. So for the month we had a gain of $84,000, which was a very good month for us. Year to date we now have $885,000 over budget for revenue. Wages, salaries are $800,000 over budget. Most of that is wellness. It's also partly orthopedic surgery. Benefits, this is the cost of health insurance increased. And the $780,000 we're over budget in materials and services. The biggest numbers in that, $400,000 in contract labor that we're over. $370,000 for the wellness center, which wasn't budgeted before. And then just, of course, the orthopedic buildup. Year to date, we have a loss of $477,000, which is a $700,000 to the negative of where we thought we would be. Questions?
When we talk about the wellness center being over budget, we're not really losing on that, are we still
No,
breaking
we're
even?
not losing on that. That's
We are
right.
losing.
We're not.
We're not.
We're
Okay,
not
yeah.
losing.
Okay, I just want to clarify that.
Yeah, it's not reflected in that budget.
Exactly. Yeah.
Right.
It will be going forward,
Well, July.
July 1 going forward. That will be,
Yeah. Okay.
But it's just made our numbers difficult to interpret because
Sure. Thank you.
because it's contributed to revenue as well as expense. Okay, so for our balance sheet, really month to month, there really are not very much changes. The one big change is current liabilities went up by about $500,000, and researching that, we booked a $500,000 payable to a droid at the end of the month, so that was unpaid. So that's pretty explainable. Otherwise, really very steady. Okay, so that's it for Lake Health. Any questions on Lake Health? So then you want to talk about the
Equipment purchase and
equipment purchase.
maintenance.
did we send out the equipment that
I saw.
we had a couple of unknowns, but we had to, and so I wanted to report the purchases that were not budgeted. The first one, as we've looked at the changes necessary for the orthopedic equipment, we bought a new sterilizer. We also bought a new washer that'll be installed. The original quote included adding a new generator, a steam generator above in the mezzanine, and bringing steam down to it. When the Steris representative came, he said, "Oh, you know, you don't need that." It was a mistake. We do need to have that second generator of steam. And that ended up costing $16,245. So we didn't have any choice. Originally, they said they needed it, changed their mind, and then they came back and said, well, we made a mistake. Second thing, that we have what's called a glide scope. This is a tool used by the physicians, nurse practitioner, the nurse anesthetist, to assist in creating a patient's airway. So if it's a create, well, when they're intubating a patient.
Yeah, it helps them put the tube down, it helps them see. It shows the way
It helps, makes it, and it's
down.
important for patient care. Our glide scope that we've used, it is used, or we sent ours in to be replaced, and it could not be replaced. It could not be repaired, so we have to buy it. The cost for that is $18,373. This is a patient care issue, and we want to be able to provide, especially when we're doing surgery. So I'd like approval to do these two purchases that we felt we needed to do. And they were not budgeted.
What was the total?
18,373 and 16,245. So that's 34,
600 some.
Yeah. So that's what I would like approval to do.
I'll make the motion that we approve the purchase of the pieces two equipment as presented.
Second.
Okay, been moved and seconded to approve the purchase of the generator, the steam generator and glide scope. All those in favor?
Aye.
Aye.
Opposed? Hearing none? You get to move on.
Could we, and I'm not sure where to insert this, but with equipment, we received a letter from Collins McDonald.
Yes, you did.
On that. Where are we and how does that list come about, Charlie? That was a very, very generous.
Yeah, that was.
Absolutely,
that was
absolutely.
original story.
What we have done for quite some time is we don't ask Collins McDonald every year, but every now and again, every couple of years, we ask them for something. And with the assistance of our medical staff, selecting items that are really, in their mind, needed. And so Dr. Gallagher had been very active in working on that list. And so the items that were recommended, and essentially what happens is members, we put out notices to the departments and say, what would you see as something we should add? And then the medical staff reviews that and makes recommendations. From that, selects the items, and then we come up with a number and ask Collins McDonald for assistance. That's the process to get that. So it's really vetted by. And many times they say, no, I really think this is a big ticket item that we want to get.
And we've written a letter of acknowledgement and thank you to Collins McDonald.
I believe we have. If not, we will have one done tomorrow.
What was the value?
It was $100,000.
Very nice.
We purchased, the cost was a little bit more, but they granted us $100,000. This is marvelous.
Yeah.
So,
Yes. Okay, Cheryl, Lynn's.
Lakeview Gardens, Goose Lake, Lake Health Medical. Lakeview Gardens had a patient count of 705 patient days. That is the highest month that we've had this year, and it's just about 24 patients for the whole, every day for the whole month. Our revenue for the month was $205,000, which is well above our average of $169,000. Good month. P&L, so here is May. Good revenue. Kind of everything's about normal in line except for contract labor. So contract labor for this month was $57,000. So when you compare it to what we spent all of last year, you can see that contract labor is having a huge impact on Lakeview Gardens. So, for the month of May, we had a net loss of $34,000, and when you net it out with what we're spending on startup expenses, which really aren't operating expenses, that loss was $21,000 for the month. So for the year, we actually have a loss of $207,000.
Are we making a dent on the contract labor issue?
We are continuing to try to do the classes. We're struggling.
We have to come up with a different plan. We talked a little bit about it. We've got to work on some wage issues. As you may recall, every year, July 1st is when we institute changes per the union contract to look at wages. So we're working on plans to do that. It's a tough situation.
Wages and recruitment kind of going hand in hand.
Right, attracting those people, because the classes, I mean, it's a great opportunity to take a class and have a good full-time job with great benefits. The balance sheet really didn't change at all, except that the cash is up and the debt is up. So in June, we took $300,000 out of this cash account and paid down on this debt, so that's good. Okay, any questions on Lakeview Gardens? So this is for Goose Lake Medical. This is the revenue for the month at $65,000. Their monthly average is $59,000. So they had a pretty good month as far as they're concerned. They still lost $6,800 for the month, and for the year they've lost $96,000, which is awful close to where we were last year at this time. The balance sheet, really no changes here. They're kind of just steady where they've been. The one good thing is Dr. Faber did arrive, the locum, and he should start work in the next few days.
We have the receivables there pretty well, just not here, but pretty well cleaned up, or?
The receivables for Goose Lake are not as clean as the other ones because we don't focus on them as much. I mean, I did not make it her priority. And that definitely will be something that we look harder at in the next 3 or 4 months, but I really am more interested in the hospital receivables and our clinic receivables because it's it's a larger and more impactful number for us. We've struggled because of Dr. Gilbertson. She's one of the reasons why we get behind, but now that she's gone, we should be able to clear that out, hopefully. Things will get better. But I don't know. I mean, I can't guarantee what the next doctor's going to do. Lake Health Medical Supply also had a really awesome month. They had sales of $16,000. If you were last month, they had sales of $10,000. That was by far their biggest month so far. So sales of 16 is great. They really, really are building up on the month-to-month oxygen revenue. So for the month, in spite of the $16,000, they still lost $1,900 for the month. And they've lost $92,000 for the year, which is worse, not really where we budgeted. But we are making a rather significant investment in these oxygen concentrators, which we own and will rent out. So really, this is moving in the right direction the way we hoped it would. And Michael is super excited about how well it's going.
When will it be a year?
Oh, God.
Is it?
From when we got Medicare approval, it
Oh.
was in November, if I recall.
I think that sticks in my mind too.
Double check.
Be a year in November.
Yeah, I don't think there was, when you look at the monthly averages before that, so, because there was a few months with no revenue at all, so. It's building well. I'm done.
Okay. Any questions on the financial reports? Hearing none, we'll go ahead with the medical staff report. I see that Dr. Gallagher's not here. I would assume that our CEO, Charlie White, will take care of that.
There were no credentialing issues that had to come before the board.
See, you got it easy.
Yeah, this is good. I like it. We're moving right along. This is how it's supposed to run, Chuck.
6A, 6A.
Good job.
Go up one, Don, 6A.
Oh, 6A,
This
Lakeview
one.
Gardens updates. I thought we already had that.
No,
Okay.
from,
So from Charlie, I skipped him, okay. Sorry, now I have to take that back, Chuck.
We want the old chairman.
The same name.
So we had a very good open house, it was well attended, and it, I think, made a difference for the community to get an idea of what our facilities are going to be like. We are not quite yet ready to open up. We had hoped we could open up July 10 next week. We're shooting for July 24. There are a couple of issues that are still not resolved, and we have a conference call tomorrow morning to talk about one set of issues. The assisted living, we had to, and Larry can add to this if there's any more that I don't get. We are required to hire a advisor, assisted living advisor, specifically required by the state for the first 6 months to help us make sure that we're meeting all the requirements. And all of our policies and procedures have been sent to this consultant. And we have a meeting tomorrow morning to make sure that the state is comfortable with all that we're doing. They had estimated that it would be around August 1st that we could delay about a month for the system, but that we should be able to get into long-term care quicker. That was before I went on my vacation and came back and found they had a little trouble with an issue that the architect is working on. And that issue is related to the hoods that are in the kitchens. For some reason, the fire marshal has said they need to be vented outside, and they have not been required of that when we submitted our plans. We had all the other, so they're working on resolving this issue.
You don't have a certificate of occupancy.
We don't yet, but we're close. There's another item that the state required, and that is that we have our parking lot striped specifically for the handicap locations. When the contractor for the asphalt laid it last fall, there were some divots that were not acceptable in some thin spots, so they had to cut them out and redo that. What they had planned, what Droid had planned was that once the asphalt was relayed, it was, and it met their requirements, then they would put a coat over it, seal coat. But they wanted to wait until the landscaping was done so that the machinery that's driving over installing that didn't get cause the seal coat to be damaged. Well, when our landscape contractor had his accident, that put our landscaping back. So they're going to do some temporary striping so that we can meet our occupancy requirements.
Give me a
So-
spray can.
Like I said, we have some temporary.
When did you say you thought move-in date would be for assisted living, a month out? Past, I mean, like the end of August now?
The end of August. And this is in part a requirement from the state, it's not because of this. And they're still doing some reviews. But tomorrow, when we have our meeting with the consultant and the state, we hope to address that and take away some of the requirements.
So by our August meeting, we might be in
We should.
long-term care.
Absolutely. That's our goal. Larry, is there anything I have missed?
Our consultant, she teaches the OHCA Assisted Living Administrator course. So when I went and took my course in October, she was one of the teachers there on my Thursday class. So she has a lot of pull with the state, with the policy analyst who is reviewing our policies. So she is going to be an asset to
Good.
push those along. And we have scholarship interviews on the 31st for our CNA class starting August 1st. And I was going to ask the board if anyone was available at any time during that day. We will schedule the interview.
What day was that?
The 31st. I'm not sure exactly what day that is.
Just before Labor Day weekend.
August 1st
Or
or
July
July?
31st.
July.
I'm sorry. The class starts August 1st.
Monday. Monday.
Thanks. We'll send out a note now.
Okay.
Send it out because.
Okay, perfect.
With the calendar. Okay. Any other questions?
Question on, and this was brought up to me on my way through to the meeting today. The curb, are there access to the parking lot for the curb or handicap? You could roll your wheelchair into the parking lot, or is there a curb continuous in front of the?
There has to be access for handicap. I'm pretty sure it is. I don't recall, it has to be in front of each facility.
It's in front of the garage. We have a,
Each one has one in front of the garage.
yes. And that's where our handicap parking is going to be. So the, our transportation that comes up can wheel the wheelchairs right onto there.
Okay.
Anything else?
One of Lakeview's rumors will squash right there. We won't be pushing the old folks off the curb.
No, we will not be doing that. No question about that.
Okay, next item after number 7 is the KCC draft agreement. Mr. Clay.
So we got a revised KCC agreement based on our conversation, my conversation with Dr. Gutierrez and with some of the role that Teresa and I have in our discussions about how much impact we would have. I just want you to know that it's not completed, but we are getting very close. You look at the front portion, services to be provided, KCC, and there where it says includes a designated Lake Health District representative in the complete 360-degree evaluation process. And that is an internal process within the college that would allow us much more involvement in review of how the direction is operating. The third bullet, where it would be representatives would be prioritized based on what we say, that's going to be changed to not what we say, but rather as long as they meet the criteria, the 50% would be for Lake County residents. So there are some changes that are still coming on this. I talked with their attorney about it today. Dave, I sent a copy to Dave, but he hasn't had a chance to review this.
Does it have to be Lake County residents, or could you include somebody from North Thursday if we wanted to do that?
That's a good question. Right now, I wanted to have it exclusively for our benefit, rather than to extend it to another county. If we, and certainly one of the things that we want to make sure we're doing is that our candidates are qualified. If they're just making it available to a Lake County resident who may or may not be qualified, that doesn't benefit us and it doesn't benefit the college. So they would have to meet their criteria to be eligible. And if they do, and what I am told is for this coming fall season, it is going to be competitive. We have more than the 50% for Lake County. So that's a positive thing for us.
Who's your attorney?
I don't understand,
His name is Anthony. I'll give it to you.
Charlie, I don't understand what a 360-degree evaluation process is.
That is an internal college evaluation program.
Internal?
It's the name of what KCC, how they do their evaluations. They call it that. So what that would mean is they would ask for our input. We would have is involvement in the selection, involvement in the evaluation. But I ask more specifically, since now Teresa is the chairperson of the RN Advisory Committee, that we get definitions on the frequency of meetings and the impact that that advisory committee has. It's one thing to have an advisory committee, if they don't listen, they don't do anything. So we're specifically asking for language that, as Dave would know, where we have significant involvement in the decision-making process, so that whether or not the students are able to be here, whether or not we feel that they're getting good training, that's really what we want to have.
Number of students, Charlie, is that 8 currently?
And that is granted by the Oregon Board of Nursing.
Could that be increased?
At the approval of the Oregon Board of Nursing. If the college were to apply and prove that they can provide adequate training for an additional number of students, that's a college decision. It's not our decision. But if you recall, they didn't.
We would still be at 50%, so if they went to 10, we would get 5. That's according to Steve.
That is correct. And that's why we specifically didn't put the number of seats, but rather percentage. They also, as you know, applied to the legislature to have the junior colleges get the ability to offer a 4-year degree for the RN program. That was not approved at this legislative meeting or session. But
Right, because as I understand it, OIT is turning away applicants because they don't have enough educational capacity to take the students that are applying.
one of the arguments that was presented when I went to Salem to talk on behalf of the Clement community and the community college from Salem that were jointly in this application, the college, Oregon Tech, actually has OHSU School of Nursing is housed in Clement. So it's not really an Oregon Tech campus. It is a OHSU program on their campus. And what they said was their argument for why the junior colleges should not have the ability to provide a 4-year degree program, in part was based on their belief that it isn't that there is a lack of programs, there's a lack of faculty. The problem, I don't know if that's what OHSU School of Nursing is having trouble with, but a lot of schools are having trouble finding qualified master's trained nursing faculty members, or to serve as faculty members.
You sent us information about that,
Our argument to that was get more four-year degree people, provide them with greater opportunity, and you'll get more faculty members.
So what is the annual cost to us?
It would be $75,000 plus the difference between the salary that they're able to offer right now and what a competitive salary would be. They don't know what that would be.
It could be up to 45,000.
That's the answer.
100% on that or half of that?
100%.
So we're responsible for the entire difference, whatever that is.
But not greater than.
Not greater than.
Well,
So-
I read that, but
So part of the issue is, number one, finding a candidate, negotiating salary. And because we have involvement in the decision process, it isn't a blank check. It's what can we find? And then what can we negotiate?
So when you talk to 120,000.
Conceivable.
per year.
Conceivable.
By making that a mandatory requirement for us, that most definitely would enhance, I would think, the ability to find an instructor.
That's the intent. And frankly, what we want to have is not just a program, we want to have a good program, so that when we get the graduates, because they're going to be coming from Lake County, that we ensure that they have as good of a training as we can ensure that they have, so that when they come here, we don't have to retrain them.
What part of this is KCC paying for? Nothing?
Oh, no, the initial, the first, up to the 15 stage.
69 to 63. There's not any incentive for them not to go bump it to 120 because they're not participating in any additional amount.
That's why we are involved. If we are involved in this, what we have to appreciate, rather than use numbers, because that could limit what we're talking about. What we would do is work with the available candidate pool. We don't know what that is.
So we're basically putting up to 30,000 per candidate in, for candidates.
To 45.
Well, 120,000 divided by 4.
Oh, see, that's correct. I'm sorry, I misunderstood what you meant by that.
How is this different than the original proposal? I thought we had a question about that. Is this lower?
The original proposal from prior month, no, the number is not the difference. The difference is our involvement in the decision-making process. The original was more lax. We had some say, but it wasn't clear how much. We had some say in selection, we had some say in some of the direction. Keep in mind that the college wants to maintain as much autonomy as they possibly can. And what we're trying to interject is as much involvement as we can to ensure that we are satisfied with the training that the students get. And that's really the nexus of this push.
Is this an annual contract, Charlie?
It's a 3-year agreement, but there is a cancellation period.
Okay, so what if there are no Lakeview students in the program? What sort of financial obligation do we have? I mean,
That's a good question. I don't-
that's probably not going to happen.
I really haven't thought of it like that.
But-
What I'm told is that there is quite a fair amount of interest in students. There has been in the past. You and I talked a little bit about that. Is that going to continue? I think that it's unknown how much. That's a good question. I'll ask that and bring that up as part of our discussion. What happens if there aren't any students? On the other hand, I think a key part of this is it's keeping KCC very interested in Lake County. Now, is that, what would they do if we didn't participate?
We will know in a year whether this agreement works or not.
I think so.
If it doesn't, we've got the 60-day termination.
You gotta remember, the whole point of this is not the training program itself, it's to get people to come to work for us that are adequate.
Exactly.
That's
And
right.
to knock down the cost overrun that we keep having in the budget. I mean,
It is a big issue.
I think we gotta continue on with them and see what happens. We're still early in the game.
absolutely.
Well, I guess I'd be willing for 1 year, but I want us to take a really close look at the see, because we are already heavily financially involved. To see what's the outcome, whether it's meeting, like Tom says, the criteria that we have, not necessarily what KCC has.
What we started out with is we wanted it to get going. Now we want it to get going better and be a better training, better school.
We've already spent how much money? What was it, 85,000? Okay, 75. And we've already done that for 3 years.
Yes.
Okay, and I want to seriously look at this also at the end of the year. And I would agree that it's probably, we need to give it a chance, but from a financial point of view, we need to see some advantage to our hospital.
Absolutely, absolutely. And so that's why I felt it was important for us to put more reliance on our end, because we didn't feel we were being heard.
We're also inserting what we thought were measurable quality measures. We are asking that they do surveys of the students and the employers, satisfaction surveys, and that we get to see those results. Because that's something they have talked about doing but never done. And I think they have to learn to have something measurable that they look at in terms of their own program. So we're trying to the best of our ability, trying to insert some of those things into the program.
There should be 4 spots available this fall term for Lake County. Okay, and then we'll find out how many we have. Then that's how we know.
Yeah,
And how much of that time will be spent here?
that is part of our
That's part of our
issue.
issue. There hasn't been enough, and we would have much more say over that. And that's our intent, is to demand that we have students here. It's better for the students, it's better for us, and we think it creates a more rounded, quality program. And we get to see how the students are doing, our nurses, working with these students.
Well, the whole advantage of this program was so that people that lived in Lakeview wouldn't have to travel. Otherwise we could give this money to another college.
Yep.
And so that's been the frustration, is that we didn't see that happen.
That's definitely been my frustration.
Mhm.
It definitely is, because I don't want just to be a cash resource for KCC, for a program that does not enhance what we can do here. I think that's not necessary. I hope it
Has the selection already
works.
been made for next year for students?
Pardon me?
Has the selection for students already been made for next year?
No,
Not to my knowledge.
no. What they had to do was they had to meet their criteria. So when the year ends, and the number of students graduated or finished their classes, passed their tests, it appeared that there were more than 4 that would be ready. But remember, people changed their plans during the summer. So to say, oh yeah, they're ready to go, they'll be ready to go when class starts.
Do you know some of these candidates, Teresa?
I only know one that I think is ready. Trying to remember if I know someone else
I know of 5
that are ready.
that have met the criteria.
But that's not Lakeview 5, that's 5 for the program.
Lake County
Oh,
residents
fine, like,
who have finished their prerequisites in Lake County, whether they live in Lakeview or they live in Adel or they live in Paisley, wherever. They're Lake County residents that are interested in applying for the 4 seats. Now, we're not limited to only 4. If they're all 5 are more qualified than people from elsewhere.
Yeah, okay.
But as a minimum, 4. So one of our 5, at least 5, beats out other Klamath County people. They pick the best students, I'm sure.
If for some unknown reason we end up with only 2, could this be amended some way? Because we're certainly not getting the benefit of only having 2 people in the program.
Good
Well,
question. I will
I mean, we
talk
still,
about
we still want to influence this program to be what we want it to be, which is at least their classes, their didactic classes here on site, you know, through our learning classroom, they should be able to attend here in this hospital, not in Klamath, and to have some of their clinicals here. And if some of those people that come over for clinicals are from Klamath, and they experience our hospital and want to come here to work, I think that I don't know that all of the possibilities have to, you know, just be, I don't know that we can focus just on how many students are in the program. We're trying to influence the quality of the program.
But I'm not willing to spend that kind of dollars to try to influence the program unless we have people from our county, I guess, Teresa. I just feel uncomfortable with that concept.
We'll never get the people from our county until they believe in the program.
another,
I mean, they talk about this. They know, the people who want to become
Maybe
students.
we should be looking at something totally different then.
is there a possibility in a training process that if they can come to Lakeview for some clinical work, that some of the, let's call them cohorts, if you will, some of the Klamath people could come over here and do
Yes.
some of their clinicals also, so that there is at least an understanding what happens in Lakeview. We may draw a Klamath County person.
That was what we were under the impression of from the beginning of the program. We
But
were
that
under
didn't
the-
happen, did it?
Correct, yes.
Again, our goal is to have influence in the direction of the program. And we believe that our initial stages were to get help, get it started. Remember, when we first got involved 3 years ago, it was an LPN program.
Well, Charlie, I think you should add to that statement, the goal is to have input in the program, but the goal is to also enhance our own nursing staff.
Absolutely.
And I think that was my number 1 goal all along.
Yeah.
You're 100% correct, and I'm glad you corrected me.
So can I ask the question for purposes of the agreement? Do you want these people to have to come back here and work? The intent is to get them to come back here and work, right? So not just, you're not trying to benefit Lake County residents. Lake County residents means where there could be people that are usually from Oregon, come back, jump in this nursing program and go somewhere else. That's not what you're trying to do, right? They need to live here, work here.
That is our goal.
It's our
I mean,
goal.
ultimately, our goal is quality nursing staff working at our hospital.
But we don't have any kind of agreement with the student.
Yeah, it seems like there ought to be some sort of commitment, if you're gonna open up a seat, that whoever gets it, come back here for a period of time anyway.
You're talking about the scholarship program, basically.
Well, as I was
Some
mentioning, I
type
think
of it.
all of them in the class right now are recipients of the Patricia Gainey. So it does benefit them to come back here when they're done, work that back, so.
KCC is getting that money too.
Yeah.
See what I can
Yeah.
add to that. because we still have a little bit left to work out. So what I'm saying is I'd like to add these kind of items to it and then put together a deal with the college. I think it is worth it for us to do. Even if, as you say, in a year, if we have not made appreciable differences, we can reconsider that. Does that make sense?
That's powerful.
So we have an incentive, and so does KCC. And frankly, if we want to try and get, if we put restrictions on the students from, or the residents of Lake County, that they have to come here and work here, we might be able to work out something.
But I'm just saying, if we give out $345,000, and our goal is to get nurses to come here, I would think there would be ways to do that with that kind of money.
See what I can do.
Okay.
Any other comments? Hearing none, we'll move on to the clinic remodeling. Right?
I sent to all of you, I hope everybody got the adroit estimate that they would use then to create the guaranteed maximum price. Price came out at $4,819,483. It is less than we were hoping, or more than we were hoping, less than they started out. They did put in a proviso that there were some changes that ZCS came up with on Monday that had some adjustments, and I don't know what, I do not have an answer of what that number is. So if you recall, one of the things we talked about is, for this meeting, if we had a number that they could come up with firm to do a guaranteed maximum price, you could decide whether or not to move forward. Because they did not have that final bid and with the holiday. I guess what we could do is, once I get that, have a meeting next week to decide.
That's fine.
Is that okay?
Yes, let's do that, Charlie.
I won't be here next week, Charlie.
But I'll still, can I send the information to you?
Yeah.
I don't know how much of a difference it's going to be between the 418 and whatever the change is. They hadn't had a chance to look at it.
Basically, what it reads to me is that it's just the clinics. We're not going to do the little extra grill that we were talking about. And,
That's correct.
It does not give geothermal heat to Dr. Graham's clinic.
That's correct.
Okay, that's about the main difference, really.
That and the parking lot is not included.
Oh, okay.
So what we have in the Building 3, Dr. Graham's office, is we've already ended up having to replace the heating and air conditioning units. They died on us. And if you recall, one of the principal reasons to do this is the air conditioning and heating was going out. And we wanted to get to it before we had to replace them. It didn't get done before they died. And we can't, in this kind of heat, you can't not have things. So we've already replaced them. That's why it didn't make sense to change out the entire heating and cooling for his building. Well, it's not his, but the building is. So I'm guessing the dollar amount won't be significantly different, it'll be pretty close to that by what they presented here. But I could not get that before now. So, is there anything else you'd like me to do with this that you can think of? Until I get the additional information.
Okay. Nursing report. Teresa.
I just have a couple things. One is about our sleep lab. I can't remember if I mentioned this last month, so I'll mention it again maybe. So the Medicare ruling has changed about payment to sleep labs for patients who are covered by Medicare and Medicaid. So because of that change, which was a relatively short notice, we have not been able to accept or bill Medicare patients in our sleep lab until we become nationally certified. So we're certainly eligible to do this, although it does require a fair amount of paperwork, hoops to jump through, and obtaining a sleep certified medical director, which we are in the process of obtaining and contracting with the physician who's been reading our sleep studies, and that physician is associated with Providence in Portland. So we've had a really good discussion with him. We're working through the contract with him, and we're doing a lot of new policies and some new processes. Our follow-up on our patients has to be a lot more extensive in terms of making phone calls and keeping track of patients, how well patients are doing after their study. And the physician, whose name is Dr. Bauerfein, will have to review each patient's history and symptoms prior to their sleep study. So it's a more extensive process, but we hope to have that done within the next 2 weeks to a month. So it has been a big undertaking to do that. We will be certified by AASM, which is the American Academy of Sleep Medicine, which is a very fine organization. So we will be doing that. And then the other, just a little update about the orthopedics program. We've had 3 nurses go out from the floor to get training either at St. Charles Medical Center or in McMinnville. They've observed care and processes at those facilities just to try to improve our care and processes on the floor. And certainly we continue to upgrade our processes we have an orthopedic group team meeting, which we used to meet every week. Now we're down to once a month. So lots of changes have happened, and I think it's been really good for our facility in many ways. So those were just the 2 things I thought of.
Will there be any more training for Teresa Sleep Lab as a result of any of these changes?
The only training that she'll do is online training. She does have to, it does up the requirement for her continuing education significantly. So she has to do a lot more online training for that. She's already certified as a sleep technician and respiratory therapist, but that continues.
So Teresa, what are we doing in the interim
What are we doing?
in the interim?
We have
between
had patients who have insurance.
Oh,
So
okay.
as long, if they
Okay.
have, if they're patients who are insured and not Medicare patients, we can still do them. This effect goes with Medicare and Medicaid.
But you can't do Medicare patients at the moment?
No, because we can't bill.
Right.
So that's the hard. We could do them for free.
For free, yeah.
And it's, it affects our California patients too. We do a lot of California patients. So really big, probably almost half of our population is from California.
But haven't we done Medicare patients?
Not since
Not-
this came out.
But prior to this?
Oh, yes,
Yeah.
yeah.
Prior
So
to
they
this,
made
yeah.
this effective, I want to say, June, it was
June
like
1st.
9th
June
or
1st or something, it was early in
like the
June.
9th, yeah, 9th or 10th or something like that.
So
It's
what do
fun-
we do? Put them on hold, say come back later?
Yeah,
Don't go
we've-
anywhere else, but come back later?
Well, there's been a couple patients that had to choose an alternative
Oh.
that they were offered, so, yeah. It's not, it hasn't been good for us, in terms of our volume. So that's all I have, unless you have questions for me.
But the great news about it is we will have proof that we've delivered a little better service. And we keep getting better at what we're doing.
And this medical director won't have to be here physically.
No, isn't that interesting? We can do it all, whatever, not phonically, but whatever you call that.
Remotely.
Remotely. Yeah.
We are remote. In case you haven't noticed. Anyway. Any other questions? Hearing none. Employee recognition, a pleasant thing.
It is always pleasant. We have lots of really great people. The person that I'd like to recognize this month has worked here off and on for many years, and in fact left and came back because it wasn't quite as great elsewhere as as was thought. This person makes a huge difference when it relates to working with our physicians. And when we deal with our IT issues, we have a lot of people that help out, but it's hard and it's complicated for the doctors. This person is very, very able to work with our doctors to help them, and as a consequence, our meaningful use numbers have been exceeding the required amounts since she's been, and she continues to stay on top. This is Diana Trent. She really has made a big difference for us.
Nice.
Maybe she can help us with our retention on college recruits as well. Let them know that the grass isn't always green somewhere
Pretty
else.
happy to say it's not so bad here.
And it's good sometimes when people leave to realize it isn't all that much to do. It isn't quite what it's wrapped up to be. So,
Okay. CEO report.
I took off the part about the board education, but I'd like to just jump into that because as of about an hour ago, 2 hours ago, I got an email from our association. And so I thought I would share this with you. Our legislature is constantly working on ways to figure out what to do with how to spend Medicaid dollars. And so this is the latest MISTIN. You don't need to read it right now, but I can just say that the big issue right now, if you recall, the taxing issue for the hospitals, we're going to be taxed at 4%, and they're going to increase the tax to the larger 26 hospitals 6%. But the key part now, and it's a combination of issues, but for the larger hospitals, there's, before the Gust Group, a decision to decide to cap the amount of OEB and PEB dollars. So OEB and PEB are the state programs for the state insurance. But as you read through this, you'll understand, you'll get an idea of what our association is doing. It's going to cause those bigger hospitals to have some economic challenges. It will not impact us directly. We are still paid at our cost-based reimbursement. But it will impact us if we are sending patients to bigger hospitals and they're maybe more reluctant or it's more difficult or they're not able to offer as much as they could because of getting paid less. So this is, you may see more about this in the news tonight and tomorrow. It's possible that we'll go without a budget. SINDI goes into effect, I think, it's the end of this week, is it? Tomorrow? Or is it Monday? And then it goes into emergency session. There's also one of the senators, I believe, is talking about taking out for a vote to the public. And they're working on getting that, if they could come come up with the 60,000 required signatures. It may go to the public in February of 2018, which may cause budget issues. There's a lot of mays. I don't know. But I thought it would be important for you to hear what our association is dealing with. That's the latest. As I said before, we had a really good daily days. A lot of people did a lot of work. Jen did a great job helping getting people coordinated. It was a lot of work, so we appreciate it. We appreciate everybody did a lot of things to get it ahead. I'm not sure it was quite as successful downtown. Maybe there was some timing issues and it was a warm day. Sometimes we've had snow, let alone rain, so you never know. When we talk about being approved, one of the things that we recently got, I think I sent out to you, we were granted or awarded the Tier 4 patient-centered primary care home for our clinic. That's a pretty big deal. And so we awarded that for the amount of hard work that we're doing. Our emergency department was awarded a level 4 certified trauma facility. Once again, that goes for, I believe it's 2 years. And due to the excellent work that Abby Vanetti and her team put together, we had good results. So that's really positive. We also are now certified by the American College of Radiology for CT with our new Siemens unit. So we've met all the criteria for that. So that's a big deal. We were surveyed, our mental health department, our mental health service, Lake Health Wellness Centers, was audited by GOBI. And we still have some things that we have to address. But I just thought I'd read the summary just quickly, because I think you should hear this. Overall, Lake District Wellness Center has made dramatic improvements since it assumed the responsibilities of the community mental health program. The program updated all of its service delivery policies, completed a QAPI work plan, provided personnel with all the required trainings, dramatically increased FTE specifically around substance use disorder services, acquired a separate office building space for children's services, expanded services to the outskirts of Lake County, began providing ongoing supervision and training around clinical documentation, and the main office got a makeover. All of this was done in less than a year. The dedication and loyalty of the staff to the community, members, and the agency is truly inspiring. And then they gave us a list of some things we need to work on. Not critical, a lot of it's just documentation. But I think it's really important that you know how much work Trace and her team have been doing to make a difference. And I hear time and again from community partners that they seem to believe that we are making a difference, that our team is doing.
Where are we in the overall staffing balance? Are we still needing clinicians?
Yes. Yes. There's a couple areas, and we got a resume, I believe it was Tuesday, no, it wasn't on 4th of July, maybe it was either yesterday or Monday, I'm losing track of days. And we're trying to set up an interview. This is a candidate from on the other side of the hills who's interested in possibly coming out here. We could conceivably have 1 to maybe 2 more licensed clinical social workers or licensed professional LPC, licensed professional counselors, and the 2 license criteria. Another area we're looking at is the psychiatric nurse practitioner. Right now, we contract with a nurse practitioner who's out of, it's either Legacy or Peace Health, and they teleconnect with us. We have been looking at several candidates so we can hire one to be here. We get one physically here. They can help manage the medication. there's not necessarily enough work just in Lake County, but we could contract with Harney County and some of the smaller counties, because they have to do the same thing, psychiatric nurse practitioner services. The last area that we're looking at, well, there's two areas of that. One is called a community navigator. And these are people that help support the counselors. Sometimes a counselor may be dealing with a person who has some psychiatric problems, but their life issues are overwhelming. And so part of doing social work is helping them figure that out. But if we have lower paid people that are doing navigation, helping people navigate challenges in life, and have our therapists provide better therapy. So we're looking at how we manage that. The last area is what are called peer support. This is a relatively new area. We don't have any peer support individuals, but a peer support is a classification that the state has that says this person may have been a very successful banker but got involved in a substance use problem. It may function not as a banker, but has experienced what happens when you have an addiction. It now becomes a very good support for somebody who else has an addiction. So it's peer-to-peer type support for the addiction issue, not for them being a banker or a rancher or whatever work they did otherwise, but it's a peer support condition. So those are the areas that we're looking at. We're not looking to expand and not end it. We've got to do it within our budget. So those are the areas that we're looking at. Okay?
I
Anyway,
think it's amazing, Charlie, what has happened in that past year. Yeah, just a lot of things in an area that way, and you especially was not an area of expertise. And I just think you're to be admired to work your way through all of that in that length of time.
Thank you. It's a lot going on. I put out in front of you the information that we have that are making available to patients about our guidance system for joint replacement. This specifically is for knees. There is one also for hips. But it helps give you an idea and gives patients an idea of what they would be encountering as they are dealing with the surgery and how advanced our technology really is. So it's pretty exciting that it is a part of Lake Health District.
I'm not ready for the tennis racket yet.
We have one in case you we'd be very happy to provide that. One of the things that we might be experiencing in the near future, specifically around August 21st, is an eclipse. Well, I have a hard time getting overly anxious about it. The predictions are that about 1 million people will be joining us in Central Oregon, specifically around the Madras area. Worries about fire, worries about capacity, worries about how will we as a health system be able to deal with that. Clearly the organizations, Madras, Prineville, part of St. Charles, they're quite concerned and are making a lot of preparations to deal with it, as are Burns and John Day. And then as you go to the coast, the hospitals along the coast. So a lot of people are anxious. We'll be advising the public more and more about what we're doing to be prepared for that. From our standpoint, the problem that might occur is the week after is the beginning of Burning Man. There are a lot of travelers on their way to northern Nevada, and we all experience that influx of interesting characters that come to go through that. So please be aware of that. And they're making recommendations such that You may not have cell service. There may be too many people. You don't have the capacity for cell service. To have extra water available. I don't, Y2K all again. I'm
Can I
just-
sell you a generator, Charlie?
I don't have a generator. I am not getting carried away. I'm just saying that we are taking it sort of seriously and we are getting prepared.
I am told you need special glasses. Is that?
I would encourage that anyone who thinks about eclipses to remember your high school science class. Take a piece of paper, put a hole in the piece of paper, put another paper below so you don't look at the sun. Because otherwise the ophthalmologists are going to have a dandy time dealing with those people that can't see anymore.
I'm sure we live in the age of the internet, we'll be able to Google the thing and just look at it on.
You know, it
For
doesn't.
3 minutes it's gonna take place.
It doesn't help when people ask me, what is it going to be like? I say, walk out right now. It looks like that. For 3 minutes.
Yeah.
However, it is something we need to be prepared. Those are my comments. Do you have any questions or concerns of anything else?
Yes, sir.
Thank you.
Okay, do we have anything for executive session?
We have just a couple,
Okay.
quick.
We will take a 10-minute break until 8 o'clock, and we'll go into executive session 192-660, bracket 2, bracketed A, C, H, and J.